Hi again, guys. Once again, it's me, John, here, picking on you about hips today. So today I'm a hippie. I actually was a hippie a number of years ago, so this works really well. And we're going to mess with your hips if you don't mind. So get your hips out and away we're going to go. Okay, so today, when we talk about hips, I want to talk about three things. Number one, kind of, what is it? When we talk about the hip, what are we talking about? Number two, we'll talk about what are some of the problems that you can have with a hip. And obviously there are tons of them, but we're just going to focus on a few of them that would probably be applicable for you guys, the more mature age range. And then we're going to talk about so if you have these hip issues, what are maybe a few exercises you could do to help with your hip issues? So first of all, when we talk about the hip joint, I think there's a lot of confusion with respect to, well, what does that all involve? Well, here is a pelvis, okay? So the way this is directed to you right now, this would be me looking at you from the front toward the back. So this is the front of the pelvis, this is the back of the pelvis, okay? And a lot of people think that the hip involves the pelvic area. Well, that's true to a degree, but we're not going to primarily be looking at the pelvis today. We're going to talk about primarily the hip joint themselves, which is this baby right here, okay? The ball and socket right here. Same on the other side, ball and socket. So we'll talk about everything you want to know about a hip, but we're afraid to ask today. And when we talk about the hip joint itself, I'm going to show you right now the right hip joint from the side. And it does involve a big ball, as many of you know, and a big socket. And that ball is in there so far that it's really, really hard to dislocate a hip. So I've seen patients in the past, and maybe some of you have complained that you say you feel like your hip is out of place. Well, the only way that can happen would be a severe, very strong trauma, such as a motor vehicle accident or something like that. The hip itself will not really go out of place. The reason is because this ball and socket is bound all the way around by very strong ligament tissue. And the ligaments basically hold the bones together to form the joint. So for you to dislocate your hip without trauma is impossible. In fact, the only way I could dislocate your hip would be to put you under anesthesia. Then we could maybe dislocate your hip, but other than that, it just isn't going to happen. So the major problem we see with the aging hip, maturing hip, would be osteoarthritis, where the hip joint itself starts to break down, you start to lose motion, you start to feel pain, you start to feel symptoms, you start to limp a little bit, you tend to be real stiff in the morning, stairs become a little more difficult, your endurance reduces because of the pain you're feeling in and around that arthritic hip. Okay, so not only does the ball start to wear out a little bit, but the socket it's in starts to wear out a little bit also. And when the hip starts to become arthritic, many times the primary symptom you're going to feel is symptoms right over the front of that hip joint. In other words, symptoms you're going to feel are basically in the groin area. That's the most common symptom. And a lot of times you'll feel it first thing in the morning. A lot of times you'll feel it if you're standing on it too long. A lot of times you'll feel it if you're sitting for a long period of time and you have to stand up. A lot of times you'll feel it getting in and out of a car. Tends to bring on that groin pain, that groin symptom that is so prevalent with the aging or becoming more arthritic hip joint. Also, many times you'll feel some lateral hip pain out to the side in this area. And sometimes, along with that, you'll get symptoms into the buttock, okay? So those are the primary symptoms you will start to feel with an arthritic hip. The most notable one are those symptoms into that groin area. But also, many times a person will feel symptoms going down the front of the thigh into the knee, because the referral pattern for the hip joint is down toward the knee joint in the front of the thigh. So if you have any or all of those symptoms, more than likely you're going to have some arthritic changes or hip joint irritation short of an actual arthritic change. So those are the primary bony joint aspects of the hip. But also remember, the hip is surrounded by a lot of strong muscles out to the side, in the front, and primarily in the back. And those muscles, as a hip degenerates, tend to, in certain areas, become tight, and in certain other areas become weak. And when we get to the exercise section of our talk today, I'll show you some exercises you're probably going to want to do. 1 is a strengthening exercise. 3 will be stretching exercises, okay? So with a little anatomy of the hip, let's have a little fun. So I'm going to have you stand. I'm going to stand, okay? And let's just show you a little bone you can feel. This thing here, right here, is called the greater trochanter, part of the femur bone, and you can actually feel it. And you put your hand here to the side, you're going to feel a big bump there. That bone is the greater trochanter. So that gives you a little orientation as far as the anatomy of the hip joint and the femur and things like that. That bone is this bone right here. So you can see how close this bone is to the joint itself. It's not that far in from that bone. All right? So that gives you a little bony anatomy and muscle anatomy of the hip joint itself. So with that in mind, let's proceed to things that commonly go wrong. What happens with a hip issue? All right? And again, I'm probably going to stick mostly with the most common thing, and that is hip joint arthritic change, because that is a very common thing. In fact, my wife has had a total hip replacement. Many of you probably have had total hip replacements, which is the best replacement surgery that there is right now. The recovery is the quickest. The recovery is the most pain-free of all the replacement surgeries, and orthopedic surgeons get great outcomes by doing total hip surgeries, okay? But the thing we commonly see mechanically with a total or with a hip joint degeneration is the person will lose certain movements, okay? And the most common movement that is lost with an arthritic hip is what we call internal rotation. Internal rotation, if I were to show you on this model, is basically the femur turning inward that way, turning toward the front. That is the most common loss of movement that occurs with hip joint arthritic change. In other words, it's this movement. On my right side, if you watch, it's turning that hip in, and I can feel that right now because I have arthritic change in my hip. I can feel I'm very limited on that side. It's very restricted, and when I do that, I can feel pulling or tension around that hip. In fact, when I do it, I feel those famous groin symptoms that many times you feel with an arthritic hip. Also, you'll have a tendency to lose hip flexion, okay? This movement is hip flexion. I can get my hip to about 90 degrees. Normally it's 130. And also you will many times lose hip extension. And that's this movement, okay? That movement. And many times you will lose hip abduction out to the side. But the most common restricted movement with hip arthritis is internal rotation. So many times I'll see a person, they'll come in, you know, I've got these groin symptoms, I got these hip symptoms on the outside, I got these buttock symptoms. I lay them down on the table and their leg flops out to the side. It turns out to the side. pretty good indicator that you are going to have some degree of hip joint arthritic change if you're a little bit older, okay? So those are some of the common things we'll see. Then what we'll also do when we're suspicious of it, there are a number of hip joint tests that I really don't need to show you so much here, other than to say, when we do hip joint tests in the clinic without x-ray, we are going to provoke this hip joint. And a lot of it is either compression or tension on the hip joint itself. And if those movements that we're doing in the clinic provoke your symptoms, we're pretty sure that there's going to be hip joint involvement, okay? So that's some of the real common features we see with hip joint involvement, hip joint arthritic change, those type of things that many times go hand in hand. So with that in mind, what do you do when you have an arthritic hip? Okay, what are some steps you can take to deal with not only the symptoms from an arthritic hip, but also the loss of motion and weakness that many times is associated with an arthritic hip, short of getting hip surgery? All right. Well, I see a number of people that have this issue, and over the years I've developed a few common exercises that may help an individual, of course, respecting the underlying arthritic change that many times is there to varying degrees. And what I've noticed is that many times with an arthritic hip or hip joint involvement, people develop weakness, especially ladies, in what's called the abductors or the external rotators. Now, those muscles basically sit back here on an individual, okay? And these people will lose strength or lose ability to contract that muscle in these muscles back here, which do this, and they externally rotate the hip. They tend to develop weakness in those muscles, which are very important for normal walking. And when they have weakness in those muscles, which again, many ladies do, okay, just because the width of the pelvis versus that of a man, we like to start them on what's called the clam exercise. Some of you may be doing the clam exercise. If you're not, you better start doing clam exercise, because whether you have a hip surgery or you don't, it's an exercise you're probably going to want to do. And the way to do a clam exercise, I will show you. Clam exercise, I will have a person lay on their side with the muscle I want to work on the side that's not on the table. Bend the knees, keep the feet together, and I just have them start lifting the upper leg, and that will start working these muscles back here, the ones that tend to get weak. Now, I don't want to lift it so far as to rock my whole pelvis back. I want to lift it so far, just enough that I engage the lumbar spine. Once I engage the lumbar spine, I've gone far enough. Okay, so it's up, down, up, down, up, down. I'm already starting to feel that here, okay? And I'll have people do that, usually one set a day. I'll have them do that to the point where there's fatigue in the muscle or it starts to burn or shake, or 30 repetitions. If they can hit 30 repetitions, I will add some resistance to that motion. So that's the clam exercise. That's the strengthening exercise that many times people need to do. There is another strengthening exercise I like giving to the hip patients I see, and that is simple bridging. And this will more than anything else fire your butt muscles, which tend to become weak. Okay, and simply you tighten your butt muscles and you lift your pelvis to the point like that, hold it 5 or 6 seconds, and down slowly. That's called bridging. I'll do it again. And hold, firing those glute muscles, those butt muscles, hamstrings a little bit, low back a little bit, and then down. So those are two strengthening exercises that you are going to want to do if there's a hip issue. And again, if any of these exercises are giving you too much pain, you got to back off it a little bit. So pain, no gain is not necessarily true here. Okay? So those are two strengthening exercises. But to me, what's more important when there's a hip issue is some stretching of commonly tight muscles. And the commonly tight muscles we see with hip issues involve the hip adductor muscles inside of the thigh and the deep hip flexor muscles primarily that get tight, but also sometimes the deep piriformis muscle way down into the buttock region tends to become also tight. So I'll show you stretching for those. Then I'll put this all into perspective, all in a little kind of line for you as far as what exercise goes first, so on and so forth. Okay, everybody still with me? Are you still all hipping with me? Good, all right? So if I want to stretch the hip adductor muscle on my right side, I'll bend the knee up and I'll just put it down to the side and I'll just hold it for a couple, let it there for a couple minutes, like gravity stretch it. Stretching this side. If I really want to get fancy, or if you can't sit in this position, I'll have people put their feet together with their knees and hips bent. Just let the legs down to the side. Ooh, I can feel that real good. So this is a stretch you just want to maintain for a minute or two. You don't have to bounce or anything. Just let gravity stretch that out. And again, if something becomes too painful, just back off it a little bit. So that's for stretching the hip adductor muscles, okay? Then you want to stretch the hip deep flexor muscles, which commonly become tight. Good way to stretch this side would be off the end of a table, but I'm going to show you like this, just laying down. I pull up one knee enough to flatten the back, and you let this leg just hang down. Just let it there. That will stretch this front part, which is also always a real good thing, tends to become tight, especially with hip involvement. And I'll just let that hang there for maybe a minute or two. Then you can flip and do the other side if you want to. So those are two stretch exercises. Then the third one is for that deep, small muscle we call the piriformis, which tends to become tight with hip involvement. Good stretch for that is I'll bring the leg up, I'll turn it out, and I'll grab hold of the ankle and the knee, and I'll pull it toward my, I'll pull it toward my opposite shoulder. Feel that pull right where that piriformis is, right in there. And I'll hold it and back off. 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 So I've given you 3 stretches and 2 strengthenings. So in what order or what sequence do you want to do the exercises? Well, research has shown that you probably want to stretch before you do the strengthening exercise. So I'd recommend, if you're going to do these, do the 3 stretches I showed you before you do the 2 strengthening exercises. Just a recommendation. But I want to give you a little warning, and that is if you have had a total hip surgery, especially a posterior approach, some of the exercise you got to be a little more careful with than others, and that's especially the flexion type exercise. You don't want to bend that hip and knee much past 90 degrees, or you run the risk of dislocating that hip, which my assumption is none of you would really like to do. If you've had an anterior approach to a total hip, you don't have to worry about those cautions near as much. So we've talked about what is the hip joint. Let me get it again. When we talk about the hip, what are we talking about? It's not this whole pelvic region, but it's really this joint right here is what we're talking about. We've talked about common findings, common symptoms, common losses of movement, common weaknesses that come with a hip joint that is degenerating or deteriorating. And then we've given you some exercise you can do. And the question is, does the exercise really slow the process of arthritic change? I don't know that. I don't know if there's been research to really prove one or the other, but these exercises we're talking about are common findings that we have when a hip joint degenerates, especially. So they're exercises you can do to possibly reduce symptoms, increase range of motion, increase strength in and around the hip. And if you wind up having to have a total hip surgery, basically they're going to be exercises you're going to do anyway. So get used to them. And if you don't want to get used to them, tough. It's your problem. All right? How's that for Mr. Mercy? So I think we've really covered the things I want to cover with the hip. Sorry I can't answer your questions today because I'm not with you, but maybe down the line when we come back, I believe it's December 21st to talk about the knee. If any of you are going to be at that and you have questions about the hip, we can ask them. We can deal with them then. Okay? So from one hippie to a bunch of other hippies, this is always fun talking with you guys, and look forward to getting back together on December 21st. I believe we'll be talking about the knee that day. So with that in mind, good to see you. Looking forward to the 21st. Thanks. John out.